everybody. In this session, I'll be discussing with a triple board certified psychiatrist what happens when parents get stuck between big pharma's promises and doctors' reassurances. Please help me welcome Dr. Sulman Aziz Mirza. Dr. Mirza, welcome back to the show.
It's always a pleasure to be back over here. So talking with you about some of my favorite stuff, ADHD and meds and controversies and all that fun stuff.
So happy to see you again. For those who haven't met you before, could you take us towards a couple of seconds and introduce yourself?
Yes, I'm a physician based out of Northern Virginia. I am, like you mentioned, triple board certified, meaning I am board certified in general psychiatry, child adolescent psychiatry, and addiction medicine. So a lot of schooling, and a lot of tests, and a lot of fees, and all that stuff. I'm based out of Northern Virginia. Like I said, I work primarily with the Nova Health Systems, which is one of the largest health systems in the Northern Virginia area, where I do primarily children and adolescent work over there, working with a lot of kids on ADHD, autism, anxiety, depression stuff, primarily just outpatient. And I also work in the residency program for the children's or for the pediatric residency program. I'm one of the instructors, so they all have to kind of go through me so before they get to be like real pediatricians. Then I also have like private practice working with adults called Loud County Psychiatry, where I do a lot of ADHD, autism, addiction, and then sports psychiatry. I also do Spravato, one of like the endogenous ketamines for treatment-resistant depression. And then, if I wasn't busy enough, I've been content creating as well. I've amassed somehow over 100,000 followers across various social media platforms. I do a lot of like education, entertainment, and I try to make mental health, psychiatry, medicine talk very accessible for the people. So that's kind of my goal and my mission overall, is like make it very down to earth and not make it, you can break a stereotype of what a psychiatrist is quote unquote supposed to look like or sound like or talk like. So yeah.
And that's why I love talking to you. That's exactly why, because you explain it in layman terms and not make it a big deal of it. Before we go on with this session, I just wanted to remind you that you can still upgrade to the Summit's VIP Pass. Besides the lifetime access to all the sessions, you also get the audio files, you get the workbook for each session, you get the expert action blueprint with key takeaways from each masterclass, you get the English subtitles, and really a bunch of other things that will save you tons of time and really make a huge difference with your kid and with your family relationships. So if you're a busy parent and you want to get the most out of the Summit, then I really encourage you to find the button somewhere on this page and go check it out. You can still get access at a discounted price before our Summit ends. And now, let's get you back to the program. So, Dr. Mirza, let's start with that. You prescribe medication also to teenagers every day, and you tell their parents it will unlock their potential. So, if someone had said those exact words to your mother when you were adolescent, when you were 15, and you believed them, what's the first thing that would have changed in your life back then?
It's hard to say, right? It's interesting because my mom's actually over right now. She's in the other room. We could probably jump in and like grab her, ask her. But I think my mom is a family physician. She's an immigrant from Pakistan, so there's like that mentality that's kind of there. And then my dad is a environmental engineer working for the state, also an immigrant from Pakistan. So part of my journey, part of my story is that like I'm a late diagnosed ADHD. Like after I completed my training in psychiatry, then I was later diagnosed after I'd been doing all these evaluations. I was like, wait, this is my life. So if I'm at 15 and someone said this to my parents, I think they would have been like, they probably would have been like, yes, we want you to do it, because I was, I half jokingly kind of say like, hey, let's, that I was never good enough, right? I could always be better. And I was one of those kids, one of those people going through it. Like I was doing well in school, I was doing really great in school, I was able to do really fine, but I was never the top, right? And I have a comparison of my sister who's also over here in the other room, like who was smarter than I was, right? I did really well in SATs, but she did nearly perfect in SATs. I got admitted into like pretty solid college, but she got admitted into like a 7-year advanced med program out of high school, right? Like so she was always like one up on me. So I was, again, a lot of immigrant children was told like I wasn't working hard enough, right? Or I was being lazy, or I just needed to work harder, and I would get blamed like, it wasn't just like a medication thing, or it wasn't like a potential something wrong with my brain at that time, right? It was more like I was lazy and I was playing video games, or I was, not studying as much as I could have done, because there's always somebody, I remember my dad would say like, oh, there's some guy in the office whose son just wakes up in the morning and studies until like midnight, and then, it's like I could always do more, right? So there was never the possibility that, like there was some reason that I was struggling. And again, not even struggling, but like not, I was getting 95s instead of 100s, right? Which is always like, where those 5 points go? Why'd you get those wrong?
Mm-hmm. If we go to the meds, you said that up to 80% of psychiatric medications in America are prescribed by primary care doctors, not by psychiatrists, and that patients are often just kind of handed the pill without the necessary therapy. So if the system is that reckless with these drugs, are parents kind of entirely justified in refusing them for their kids? You know what I mean?
Yeah, it's interesting, especially for looking at things like ADHD, where ultimately when the studies are done, we go back to like the MTA study, which is kind of a landmark study in regards to ADHD and the effectiveness of medications versus therapy versus other kind of treatment as usual. Any kind of treatment options that were showing to have better outcomes always involve medication. So for ADHD specifically, it's almost like, sure, you can do behavioral stuff, you can do therapy stuff, you can do diet activity and physical activity and structure and blah blah blah, but it's the medicine at the end of the day that really makes a difference. There were significant differences between people who did therapy alone versus therapy and medication versus medication alone. The medication was always the common denominator amongst the things that were having significantly improved differences. So I think for that specifically ADHD and all the stimulants, there is almost like it's the medicine that's really doing a lot of the work. So that's a little bit more acceptable per se. For other medications, things like antidepressants, antipsychotics, and mood stabilizers, we're looking to treat like anxiety, depression. That's where I see a lot more of the failing, right? In regards to like of people who are like just take the pill and get better, or quote unquote get better. And when you're not doing all those things like therapy, behavioral techniques, sleep, dietary stuff, etc., that's where you're going to get the quote unquote failed treatments, or the medicine didn't work response. So that's where the problem is. It's really making sure that we look at what the problem is and what's the best way to address that. Things like, again, commonly with teens, anxiety, depression that we see, those are episodic, reactionary to something going on, and we want to really look at what's underlying and how we can modify those things. Things like ADHD, neurodevelopmental disorder, that again is going to be a little bit harder to just respond to something like just use a planner, right?
Mm-hmm. Sure. I love how you say that you're always blunt about that prescribing for ADHD teens, let's say, actually makes your life harder. More liability, more phone calls, more paperwork, etc. So when a parent sits across from you and says, you just want to drug my kids to make them compliant or something like that, what specific thing do you say to convince them that the medication is for the child's happiness and not for the adult's convenience?
I kind of asked them, I was like, well, if you didn't want them to be on medication, why did you bring them to my office in the first place? It's like if you're here, you've been told to come to see a psychiatrist, or somebody's going to make a referral, or you yourself have made a referral to be able to come to the psychiatrist. And, psychiatrists are kind of simply misunderstood as like the medicine people in mental health. They're the ones who give the medicines, and that's what their job is. It's like, oh, we do a little bit more than just give everybody medicine. But it's like, if that's what the lay understanding of the field is, why are you in the office in the first place? You don't have to be here. Nobody forces you to be here. And a lot of times I'll say to people, I was like, you don't have to take medicine if you don't want to, right? Like I don't care. I will go to sleep fine. Again, like we talked about the beginning, like it's one less thing that I have to worry about. Well, I don't have to worry about refills. I don't have to worry about chasing down prior authorizations or calling pharmacies to check stock and none of that stuff. It's easier for me to not prescribe anything at all, because my liability is done at that point. So why would I want to take on extra liability at all by prescribing something for your kiddo? And the idea is that like, it's, and I don't get kickbacks. Like people have this idea that like, oh, you get money from people, from the pharma companies. Like, no, they don't give me money. That the hospital system doesn't give me any money for prescribing anything. I get paid the same whether I show up and see patients or I don't, or whether I write prescriptions or I don't. So right now I'm on FMLA for paternity leave, I'm getting paid for that. I'm not writing prescriptions, right? That's how it goes. That's how the system is. So it doesn't matter on that end. And ultimately, it's like, again, it's like if you're here for a reason, what is the thing that's bringing you into my office? office. And it's the first thing I ask people when they step in the office, right? Is like, what brings you here? What is your goal of working with me? And if you say, I want to do better in school, or I want to improve my mood, and I offer multiple options, one of which may be medication or may not be medication, and you don't agree with it, okay, it's your call. You can go and do whatever you want to do. So, yeah.
Right. In a previous question, you were discussing that prescription often comes, before trying therapy, exercise, or restructuring the team's environment. Why is that?
Because it's easier. It's easier. Yeah, it's convenience, right? Ultimately, it's easier, and there's almost kind of this expectation when somebody goes to a doctor that you're going to leave with a prescription. And it's interesting. I go on Twitter, X, whatever the heck it is they're calling it now. This terrible, terrible website. You get these arguments, and you see this stuff out there, and it's things like, oh, if doctors only prescribed medication or no, if they only prescribed exercise and diet, all of the health problems in the world would be solved. It's like, oh wow, what a novel idea! Like we've been only asking and telling our patients, improve your diet and do physical activity, but people don't listen, right? So it's only if our patients listen to what we said, then we wouldn't be in these other situations. So I find it really hard when people say things like, oh, my doctor never recommended these things. It's like that's the first line treatment for almost everything. Like if you have high blood pressure, it's like lifestyle modification. You have prediabetes, lifestyle modification, which is diet and exercise. Same kind of thing goes for mental health, right? It's like you want to do lifestyle modifications, which are going to be things like making sure you're exercising, making sure that you're eating enough, making sure you're drinking enough, making sure you're sleeping enough, making sure you're having connections with people, right? Those are the fundamentals. I made a YouTube video some time ago, which is like the three things that are the foundation of mental health are nutrition, hydration, proper sleep, and then human connection, and sleep as well, right? So sleep we talk about, and then all those things are necessary, and then you can talk about everything else in regards to anxiety, depression, medication, therapy, blah blah blah. But it's like you have to be doing those things first and foremost for anybody to function well.
And let us stay with that a little longer, actually, because I know you validate sports, exercise schedules, nutrition, sleep, whatever you just said, that are effective. That are natural ways to manage ADHD and hyperactivity. So if keeping a teenager busy with soccer or any other activities genuinely works, why would parents, not exhaust every non-chemical option before letting you write a prescription?
They should, right? And that's ultimately what it comes down to is that they should do all those things, right? They should work on sleep at home. They should work on making sure that they're eating enough at home. They should make sure that they're keeping active. It's when they're doing all those things, but the problems persist, is when they come to the office, or the problems are getting in the way of being able to do those things. It's very common that I hear people are like, I take my kid to karate or I take my kid to soccer after school, and they just can't function there, right? They're all over the place. They're not able to do them, the taekwondo and martial arts. They're not able to listen to the instruction, or they're zoning out playing soccer. They're just standing in the field looking around, and people are scoring goals on them, right? All these things get in the way that all those ADHD symptoms are showing up as being problematic and getting in the way of being able to do anything. So that's where it becomes a problem, right? So and in school, right? So imagine that they're still doing all the stuff they need to do and they're not functioning in school, and that's when the problems arise. It's like, okay, we're doing all those things, now we have to look at something else.
So how long? If you help us understand, how long should a parent try all of these other non-chemical options before you would say, this is not enough, we need to talk about it?
And it's always individual, right? Ultimately, it's individual. And I always say to people, especially like my residents, when I'm teaching them, I was like, ADHD is not a problem until it's a problem. Anxiety, depression is not a problem until it's a problem, right? When it starts interfering in life and when it really makes life unlivable, or significant problems are occurring, and you've tried all the things, and whenever the parent or the child feels like, okay, something's got to change, that's when we have to be looking at, all right, what are our options? What are the things that we're doing or not doing, and how do we improve those or modify those?
Right. So let's say the meds are working. The teachers see it, parents see it at home. Sometimes even the grades show it that the meds are efficient, the meds are working. But the teen turns around and says, I don't feel like myself. I'm not taking them anymore.
Yeah.
So when a 14-year-old, when a kid tells you the medication erased something they really like about themselves, how seriously should parents take that statement?
Very seriously. I again, like, go back to Twitter, getting into arguments with people online, is like, I really value the idea of patient autonomy. And I try to instill autonomy in my patients from the first visit, no matter how old they are, right? Even for 5-year-olds and 6-year-olds, it's going to be like, this is your body, this is your healthcare, and nobody should be doing anything without your permission, and you shouldn't be doing something that you don't want to do. If the kiddos feel, and again, people are like, oh my God, 5 and 6-year-olds, what do they know? It's like, they know more than you think. They have a good grasp a lot of times of like, these things are different, or I feel different when I take the medication. Again, is it the same language that myself as like a 40-something-year-old medical doctor is having with a parent? No, it's going to be on their own language, and they'll say stuff like, I feel different, or I don't like how I feel. And that's our job, our training, to kind of figure out what that thing is, what's the problem, and how we can make that different. So if they're feeling like, if teenagers are like, I lost my spark and my joy, we don't want that. People will talk about like the zombie effect of it. And it's like, we don't want the zombie effect. We want you to be you. We just want to help you be a better version, a more optimal version. So I never want somebody to feel like I feel like a different person negatively, right? So that's what I encourage, that kind of communication with them, to be like, talk to me about that. Like if you notice anything, or talk with parents, talk with me, share with us so that we can come up with a different plan. That may mean like alternative medications, right? Trying something else. That may mean switching to something else. What that may mean stopping the medication, right? It may mean any of those things. Just because we want to make sure that you're, again, like the patient, the kiddos have control and again, the autonomy over their care, and they're in charge of their healthcare. So we want that to be instilled very early, and just so that it's there, so that they feel like they're part of the treatment, that they feel like that they are the treatment. So I always say to people, this is Team Johnny, right? And that we're here all as part of Team Johnny. Your parents are part of Team Johnny. I'm here as part of Team Johnny. I'm not a doctor says person. I'm not going to tell you what to do. I'll give you options, and you make the choice. Ultimately, what you want to do. And there are times where teens will say like, I don't want to take the meds anymore, and I was like, okay, I'm not going to force it. And then and then what I'll ask them a lot of times then is, what would need to happen? What would need to change for you to kind of reconsider? For you to kind of have a moment to say, maybe I was doing better on medication. Maybe this trade-off may be worth it, or maybe it's worth kind of taking it from a different point of view to see if there's an alternative that may be less side effecty. So again, it's the idea of like, and again, like, I'm cool not prescribing medication. Like, it makes my life easier. I'll say that over and over again. It makes my life easier not prescribe the meds. But I also want them to kind of advocate and say, maybe I do need it. Maybe it is doing something for me, and that door is open. And we can always come back to it if we need to. And at least want to have that in their mind to be like, do you notice a difference or not?
Dr. Mirza, time is a huge factor in that as well, right? With the meds. How does the parent tell the difference between, this medication isn't right for my child, and my child just hasn't given it enough time?
I think if you notice significant changes or deviations from the baseline in a negative way, that's a red flag, right? And I give all my patients, again, like, this is what you should expect, right? And these are kind of like common side effects that we're looking out for on follow-up visits and things to reach out for. If you're noticing anything that is like beyond that, again, those are reasons to kind of say, let me make a call, or let me touch base, or stop it if I need to. So anything that is like unexpected, I think, is fair game to kind of say, we need to do something, whether it's changing or stopping.
Noticing brings me to the next questions, Dr. Mirza. We know that ADHD teens tend to struggle behind the mask, right? So how do you measure that struggle in a way that a skeptical parent can just dismiss it as normal teenage stress?
It's hard to say in a way. I think that is going to come down to ultimately the relationship that you have as the doctor, as a provider, as a therapist, psychiatrist, whatever, with the teen, and allowing them hopefully to kind of open up with you to share and say like, this is different, or this feels wrong, or this is more than just like a quote unquote normal struggle, and advocating for them, if the parents are maybe not on board, or if they're kind of downplaying a little bit. So we've done that at times, right, where parents will try to minimize what the teen is going through, And the team may have talked to me like, this feels worse. This is worse than what I think they're going to say it is. And then you're going to try to advocate and be like, I think they shared, and I'll always kind of ask permission, without divulging anything, say like, is it okay to talk about it? And it's okay to talk about what we talked about alone per se. And little Johnny said that like it's a little worse than you think it is, right? If they're struggling a little bit more than you think that they are, or that in general that they have in the past. So really trying to emphasize that as much as we can too, to say like we're on our side, we want to facilitate that communication.
Mm-hmm. So I want to ask something directly because I think parents need to hear a psychiatrist say that
Yeah.
out loud. Is the fear of medication irrational, or are there genuinely cases where you've seen doing more harm than good in a teenager?
Yeah, 1,000%. Like I think it's impossible to say that like there's anything that is universally like great and without any kind of problems at all. Even the things that we talk about like exercise and diet, like we know people can get injured from exercising, right? And they can die during exercising, or they can have diet issues that become like eating disorders, and like all these things that we have to kind of understand that like anything can become problematic. So medication, of course, there are going to be side effects that are unexpected that could be problematic and dangerous. That we want to make sure that like, hey, again, this is why we talk about communication and have those follow-ups and make sure to like, give those informed consent and say like, make sure to reach out if this and that happens, right? Or keep those things open. So I always have that when we prescribe medication is, saying that like, if you have anything unexpected, just reach out and let me know. Even from private practice, again, we have a messaging line that they're always able to kind of like message and say like, this is something that's happening. What should I do? So that's very, it's rational to have a fear of any kind of treatment, including medication. So again, there's not 100% in any way, shape, or form. So that's why again, that the whole communication is necessary.
Yeah, honestly. So what is the actual unromanticized list of side effects that you walk parents through before you write your first prescription?
Yeah, so for things like ADHD medications, the most common things we see are appetite suppression. It's almost kind of expected that we're going to have some appetite suppression. So looking at ways to kind of get around that, mitigate that in general. Trouble with sleep is a potential option just because of the stimulant effect of it. That's a common thing. So again, the best way to mitigate that is timing of it, and knowing what is like the latest time that you can take it versus, having a certain cutoff time for taking it. Some people can have like increased heart rate as a stimulant works on your heart. It can make your heart beat a little faster. That can lead to things like anxiety for some people. Again, that's an option. Those are the most common side effects. So again, more rare side effects are things like psychosis can occur, right? So if you take high enough doses of it, or if you're just extremely susceptible to some of the effects of it, you can have psychosis, hallucinations, auditory, visual hallucinations. That can occur. Some people, again, there's misuse potential with any of these stimulants. So a lot of like the stimulant medications, there's potential misuse. So that's something we just have to kind of watch out for and be aware of. It's a real thing. There's diversion. There's a black market for these things, so people can sell them, make some money. That's something we just have to kind of be aware of as a whole with stimulants. For things like antidepressants, you can have apathy. That's something you can have apathy overall, a lack of emotional blunting. You can have worsening anxiety. You can rarely have an increase in suicidal ideation. Some people have what's called like a paradoxical reaction, where they'll have the opposite of what's intended. So that could be increases in suicidal ideation, thoughts like intrusive thoughts as well. Some people, the most common reason people stop antidepressants is sexual side effects. People will have, it is not uncommon for people to have all kinds of sexual side effects, things like reduced libido, reduced performance, things like again erectile dysfunction, inability to ejaculate or premature ejaculation for women, loss of lubrication, loss of pain during intercourse. Again, there are reports of people having permanent sexual dysfunction even after stopping it. So it's rare, but it can occur. So it's something, and people are like, oh, well, teens should be having sex. I was like, well, teens do have sex. Kids, we want them to kind of develop this sexuality and sexual interest is a normal human emotion and function, and we want them to be able to have these as in an appropriate ways as they get older and all that stuff. So yeah.
One of the first things that you mentioned, the side effects, is the appetite.
Yeah.
So the teen stops eating, loses weight, and the kid uses that as another reason to refuse the meds.
Yeah.
So when a teen says, "These pills make me not want to eat, and I really hate it," is that a valid reason to stop? Is it a reason to switch, or just something that the kid needs to push through?
Coming back to what I said before, is like any reason is a valid reason to stop the medication. Like anybody says, if they say like I just don't want to take it anymore, I find it really annoying that I have to take the medication. Like I can't force pills in people's mouths, right? I'm not going home with these people and like waking them up and being like, here's a pill, take it, put it in your mouth. Right? Like it's their choice at the end of the day, ultimately, what they want to do with it. So that is a very valid reason. There are plenty of people who are like, I'm doing things like sports and I need to maintain weight and I just can't, exercise or I can't eat enough when I'm on this medication. Or I feel extremely nauseous, so they just don't do it, so they don't take it. That's, I can come back to it. But then if they say like, I still want to have some effects, that's when we start to look at other options, whether that's switching to a different medication, changing the dose, adding something like an appetite booster. A common one is something like cyproheptadine or periactin, which is a medication which can actually help to increase appetite. So we look at the workarounds, right? I know people are like, well, I can't do like a whole meal. So I'm like, what about if you do snacks during the day? Like, is that an option to kind of get those calories in and then make it up maybe at lunchtime or dinner time or breakfast time? Just have the timings around. So it's more like how can we make it work for you, and which may or may not include switching to something else or getting off the medication or trying something different else.
Right. And if they do get off medication, what actually happens clinically? Can they just pick it back up 6 months later, a year later?
Yeah, in theory, right? Again, stimulants are short half-life medications that get out of your body, essentially overnight, right? It's supposed to be like a whole brand new day. You take it, you sleep, and then it's a whole new day. That's why a lot of people will take the medications on a daily basis. In reality, it's like a few days for it to be like fully gone out of your system. But still, relatively quickly, you're able to get it out. So, and the idea is like with things like stimulants, you don't need to kind of like ramp it up or do a whole it's not something you have built up in your system either. Like something like an antidepressant where you stop it for a few months, then you're kind of having to you don't want to restart the same dose. In theory, with the stimulant, you should be able to start the same dose again. There are plenty of patients I've had who like take summers off or take breaks off, or they may take it. A lot of people commonly will just not take it on weekends or non-school days or work days. So in theory, right? Again, I say this like in theory is that you should be able to kind of start and stop it as you need it. There are some people who again, their bodies may get a little more used to it. They may have discontinuation and withdrawal symptoms, so it may be harder to kind of like take those off. But again, that's not the usual case.
Okay, cool. Okay, so I want to end on something that I think a lot of parents in this audience are actually dealing with for quite a while. This is anti-psychiatry groups that target vulnerable parents with documentaries, claiming the entire industry is driven by profit. So when a mother, walks into your office holding a pamphlet from one of these organizations or is under the influence of a documentary like that, how do you dismantle that argument without sounding like you're just defending the big pharma?
Yeah, I mean, I go back to what we kind of joked about in the beginning, that like again, I don't need to prescribe anything. Like if you're not my private practice, it's like you're paying for my time, you're paying for that, that's what you're paying for, that's what you're getting billed for, right? It's like the time that you're spending with me, again, not based on whether I write something or not. I've had patients that I've seen for years that I don't prescribe anything for, right? So, but they'll still come and have visits with me, even though again, I'm not prescribing anything. And what's coming back to me at the end is the same thing, regardless, right? It doesn't matter. There's no difference on that end. So from that point of view, whatever, I don't care. But like otherwise, I mean, like again, people can believe in conspiracies and they can think that like again that big pharma is in charge of all this stuff, but it's like reality is not. We hate big pharma. We have a love-hate relationship with big pharma. I'll say we have to rely on big pharma in a way for providing things like medication and doing the research for things like medication, coming up with new different medications, which can be helpful for a lot of people. We don't love the fact that we have to deal that like the money stuff that's involved with it. We understand the politics of it. We don't love that aspect of it. But at the same time, like I have to appreciate that like a pharmaceutical company is coming up with new ways of making medication that can get into my patients who may need it, especially for kids who have like developmental disabilities who may not be able to swallow a pill. That pharma company decided to put research and development into creating like a patch, right? That comes from pharma. I have to kind of say like, thank you for that, right? It doesn't mean that I'm like now influenced to say, well, now I have to prescribe. No, right? I still have choices. I appreciate that they provide choices for me, right? That I can use these different skills. I don't love again how much the financials of it all. So it's a love-hate relationship, that's there. But does it influence? Not for me. Like, I always try to keep costs and stuff in mind when I prescribe medication. Like one of the reasons like my favorite antidepressant is like Prozac is because it's cheap. It's old as gold. It's generic. A lot of times I use generic medications. I very rarely, I will try to actively avoid using medications that don't have generic unless I have to. There are certain ones again that like only come in a branded form, and we're all kind of counting down until they become generic in a way, just because it increases access.
And I'm with you on that. I mean, love-hate relationship with big pharma. I get, those groups can cause harm, but can you separate, their misinformation from the legitimate criticism? I mean, is there anything the anti-medication movement actually gets right?
Yeah, I mean, I think there are stuff, and it's interesting because again, like I talk about social media, what I've done on there is, you hear from the people that you wouldn't normally hear from. You get exposed to people who are, harmed by medication that maybe I haven't had experience with it, right? Or maybe I've not come across that. Again, if I'm looking at psychiatry is a field that is inherently subjective, right? We don't have as many objective markers as we would love to have. Again, we don't have the blood test, we don't have like X-rays or imaging or anything like that. Again, it's a valid criticism of the field that I have to rely on what my patients say to me and then what other people say and then what my observations are to kind of make diagnoses and treatment plans. And there's an element of like the trust that's there. So the question when people talk about like, oh, anti-psychiatry or these other groups is like, why would I then dismiss what their claims are, right? If they're saying to me like, this is how I was functioning, I started this medication and then I had this terrible, terrible side effect, it's hypocritical for me to blindly reject them when I had to blindly accept them for what they were saying before to kind of start treatment in the first place. So that's been, again, one of the benefits per se of like social media, even though sometimes the message gets ugly and mean-spirited and threatening along the way. But at the same time, like, there are people people that I don't agree with, but I've had productive conversations with them and learned a lot. Things that, again, like I may not have been exposed to, things that may have been rare side effects. Again, like in my training, again, like we talked about this PSSD, this post-SSRI sexual dysfunction, the people who have the permanent loss of sexual functioning. I never came across that in my training, right? It was always training-wise, we're always taught like people stop these sexual side effects are not uncommon. When people stop the medication, the sexual side effects should go away, or the sexual side effects, they should go away. And that was kind of the understanding. So when people start saying, hey, they didn't go away, and I was kind of like, well, that's not true. That doesn't make sense. I was always taught this thing. Again, once you start having the conversations with people and you're like, okay, maybe this is a thing that I have to be aware of, something that I have to be watching out for, something I have to be like letting patients know about, when we are prescribing these medications, that like there's a risk to this. Again, it's not very common, but can occur.
It can happen. Yeah. Right. Yeah. Keep rolling. Dr. Ruza, I have a couple of rapid fire questions at the end. If your teenager or patient begs you not to tell their parents that they've stopped taking their meds, whose side are you on?
I'm on my patient's side. My patient's name is the one that's in my chart, and that's the person I'm treating.
Should a parent be allowed to force their teen to take psychiatric medication?
Depends. It depends on the situation, but most of the time, the answer is no. The only times is like if there's a risk of like harm to self or others is like, again, those extreme case scenarios is like when someone needs to be forced to do something.
Right. Would you prescribe stimulants to a 14-year-old who gets straight A's but cries every day doing homework?
Yeah. Again, people talk about grades as this like excluding criteria for ADHD, and it's like that's not the case at all. There are plenty of people who have straight A's and 4.0 GPAs and perfect SAT scores who still struggle with ADHD. So yeah, it's not always about the grades.
The teen says he feels like zombie. Is he describing a side effect or describing depression?
Depends. Again, it comes down to when I'm interviewing somebody and creating a narrative history and creating that timeline. So when did it start? What were the things that happened before the zombie feeling? What changed? Right. So if they started the med and they felt like a zombie and they stopped the med, they don't feel like a zombie. It's probably the med. Yeah.
Have you ever looked at a kid and thought the kid isn't the issue here?
Oh yeah, it's one of the reasons that people say that they could never do child adolescent psychiatry or they never could do pediatrics, because they'll commonly say things like, "Because now I have two patients, I have the parent and them as well." So absolutely, there are times where the parents, guardians make the situation, and it's not good.
What's the most common lie that the parents tell you in your office?
That they had no idea where this came from, right? When parents say things like, "I had no idea they're depressed," or "I had no idea that they're anxious," there's a lot of signs along the way, or there's a lot of cries for help along the way. And I think that people are just oblivious to them, or ignoring them, or in denial of them. So I think that would be the most common lie, quote unquote, that parents would say.
And what's the most common lie teenagers tell you?
Everything's fine. Nothing's ever fine, right? When people say, I'll have the interviews and someone will be like, "It's fine, good, okay," and I'm like, "All right, we're going to not use fine, okay, good. Let's use different words. Let's use some different words and see what's going on."
How many appointments does it take before a teen actually trusts you?
Hopefully, it's the first one. And I try to set up especially the beginning part. It's like that's why it's so important to have start off on the best foot and really make sure the teenagers know that I'm here for you. I'm here as your doctor. And I say that to them, I'm here as your doctor, not your parents' doctor. You ever want to talk with me alone, kick your parents out of the room and we'll talk about whatever we need to talk about. And then I go over the things that I have to report them on, again, abuse, self-harm or suicide, homicide. And then aside from that, everything else is private confidential. And, they may test me with that to some extent. They may say something like, "Don't tell my parents." And then, when they kick the parents out of the room, they bring them back in. And then I do not reveal the thing. And we're hoping that that's enough for them to say like, he's trustworthy. He didn't say what he said he wasn't going to say.
Yeah. Brings you trust. Thank you so much, Dr. Mirza, for bringing such honesty and nuance to one of the hardest decisions probably parents face with their ADHD teens, right?
Yeah.
I believe this conversation could give families the clarity they desperately need. So I really, really appreciate you being here.
Hopefully, yeah. And it's one of those things I always tell people is that this is the way that I practice, right? I can't promise that, but this is the way that I do things. This is the way that I feel succeeded in my career so far, and what makes me hopefully doing what I'm doing. So it's because this is the approach that I have. So it works for me, it works for my patients. So
thank you for everything.
All right, okay, bye.
Are you loving the advice and insights you're getting? Well, you can get lifetime access to all the summit sessions when you upgrade your ticket to the VIP pass. This means you're not only getting unlimited access to the sessions, you will also unlock the audio version of the entire summit, expert action blueprints with key takeaways, and